content discussed on this program is often medical in nature and is used for informational purposes only. No content discussed should be taken as medical advice. Please consult your healthcare professional for any medical questions. Howdy, howdy. I'm Tori McGee, and welcome to the Rapid Recovery Report, sponsored by RomTech, the modern technology of rehabilitation. So we're going to be doing these, and if you are familiar with our Rapid Recovery Report, then go ahead and fast forward. But we do a regular series here where we talk to different guests. Sometimes it's surgeons, sometimes it's patients, insiders at RomTech, and we talk about everything, health, wellness. We also touch on the RomTech Portable Connect. So if you are new to the Portable Connect, this little beauty right here that popped up on the screen next to me is our baby. This is the Portable Connect. So it is a high-tech recovery device that's geared to get patients moving and on the go to recovering from their injuries and surgeries faster. So if you want to learn a little bit more about us, you can visit us at www.romtech.com and follow our social handles that are in the description below. So today we have an awesome guest. Let's get right into it. Dr. Butch Douthit earned his undergrad degree from the University of Alabama, Tuscaloosa, and he graduated from the University of Alabama School of Medicine in Birmingham. He's a member of some of the most well-known professional organizations in the field. So American Academy of Orthopedic Surgeons, American College of Surgeons, he's fellow, Alabama Orthopedic Society, American College of Sports Medicine, a whole mess of stuff. And he is also in the Medical Association of Alabama. He's affiliated with practices at Gadsden Regional Medical Center, Riverview Regional Medical Center, and Gadsden Surgery Center, all in Alabama. So welcome, Dr. Douthit.
Well, thank you. It's just great to be here today.
Yeah, we're happy to have you.
Yes.
Well, let's get right into our questions. So I understand that you were born and raised in Alabama, and you studied there, and you practiced there too. How much do you love it in Alabama?
Hey, I just got to say this: it's Roll Tide. Roll Tide. Alabama's been my home. I'm fortunate enough to be able to practice orthopedics in Gadsden, Alabama. It's probably about a 30-minute drive where I grew up in Jacksonville.
Okay.
So really enjoyed it. It's great. People are great here. The weather's great, and we got the best football in the country.
Yeah, well, absolutely. So you knew early on that you wanted to stay in your home state and practice there?
I did. I felt like I really enjoyed it here. I have a good relationship with a lot of people in this area. I felt very comfortable with it. I was excited to be able to come back to this area and practice orthopedics.
And I understand that you're actually opening a new location in your actual hometown, right?
That's correct. And we're in the process right now of getting all that arrangement made there, and we're looking forward to it. We're real excited, and I know the people over in that area are real excited for us too.
Well, congratulations. That is really exciting.
Thank you.
So now, did you have other family members that were in medicine before you that kind of influenced you wanting to get into medicine yourself?
Well, I did have a great grandfather who was a general practitioner.
Okay.
But other than that, it was just something I really felt like I was called to do.
Okay. And what made you pick orthopedics?
Well, I had a strong background in sports. I was really involved in sports in high school and in college. And so it just seemed like it was a natural fit for me. I did have the opportunity to work in the hospital with several surgeons, neurosurgeons, and orthopedic surgeons, but I seemed to identify more with the orthopedic surgeon and just felt like that was a natural fit.
Okay. And I mean, clearly you're still a big sports fan.
Absolutely. Absolutely.
Roll Tide. Now, you really believe in holding your patients accountable throughout their entire process. So prep before surgery, during the recovery. Would you tell us a little bit more about that?
Yes, obviously it starts in way before surgery. I mean, we try most of the time with the patients we see them multiple times probably before we ever get to the point that we discuss having surgery. And prior to that, I mean, we make sure they understand that a big part of the success of this operation is what they go prepared for surgery. If we operate on the knee, oftentimes their knee may be ready for surgery before they're actually ready for surgery. So I tell them it's a big part. Mentally, you have to go in that this is, we're going in here. This is going to be a process. to be successful, you have to participate in this process. And so we try to stress that. We try to do a good job in the office prior to that, explaining surgery. We offer preoperative classes at the hospital that go over everything, and not only a big part of just what's going to happen in the operating room, but what surrounds the operating room, what they'll even down to what clothes they need to wear. We all encourage family participation. We explain, how we use the Portable Connect, and so I think that's a big part of it. Yes.
Okay, absolutely. I mean, I imagine with it being such a common surgery, oftentimes people don't think it's as big of a deal as it is, but it's still a major surgery.
Oh, it's a very big major surgery, and we want them to understand this. But in order for this operation to be successful, they have to buy into it and they have to do their part, and that's what we try to emphasize.
Absolutely. So, I mean, you believe that patients and people do better when they're pushed a little bit before and after surgery, versus a less aggressive approach to rehab. Is that right?
Yes. So we try to focus some on the pre-rehab, and trying to get them to understand that this is a full participation operation, that they need to participate in it. Yes.
Yeah. And do people heal faster usually if there's higher expectations placed on them by their surgeon?
I think they do. Yes. We try to lay out the expectations of the surgery, and I think that, we try to tell them, I often use the phrase, and I try to tell them how important this is, because it's always nicer if you're walking down the road or walking down the trail, you know where the snakes are, you know what they need to look for, what to be prepared for. I think that, we see that the ones that come back for a second operation, having known what to expect, the first one just seemed to do better. So it just makes sense that the more you understand about what we're doing in the operating room and what we're trying to accomplish outside the operating room, I just think the better they buy into it and the better outcome we all get.
Yeah, that makes sense to me. Yes. And I assume a lot of it's on a case-to-case basis, because if you have somebody who's having a knee surgery that's, say, maybe 80 years old and not super active versus somebody who is an athlete, then it's going to be a little bit different recovery.
It is, but there again, not only we do try to, when we're talking about the patients, we try to involve their families. So most of them that are 80 years old, we try to find out, we dig into their home situation, who's going to be there with them, and we try to, we encourage them to bring along a coach, someone who there is going to be able to participate in their care to make sure, yes, obviously that, some of the younger patients that are motivated back, whether it's sports, work, or whatever, they have a lot of motivation, but we try to, we try to involve as many people, support personnel. We just think that's important.
Yeah, it makes sense. I mean, accountability is important, and having that support system is really important too. So we're really proud and we're really honored to have you working with us and the Portable Connect. So can you tell us a little bit about the results for your patients and how that's been?
Now I've been using the Portable Connect probably for about 18 months now. Okay. And it's been a great hit from the first. I mean, I can't tell you the number of patients that just come to me and said, this is great. They love the Portable Connect. They said, gosh, I wish I'd have thought of this. I mean, it's, a lot of times, and, we talk to the patient about it, and we just say, now you do realize now that, you need to get on this Portable Connect several times a day. And not only that, I'm going to be able to follow you. And they said, what? I said, yes, I have access to this to my telephone, and I'll show them. I said, I can pull this up. I can see, and so that really gets them involved, knowing that they're going to be accountable for it. But like I said, I just can't tell you the number of patients that have come to me and says, look, if you ever need me as a testimonial, I'll be more than happy to talk about this. This is fantastic. And, a lot of them go back and compare, the fact they've had previous surgeries and all, and how much, they felt like this was really an important part of their surgery.
Absolutely. Well, I'll get those names and numbers of those patients after this interview.
I will do it. I've got a long list of them, yes.
Okay, perfect.
Yeah.
Now, you also combine physical therapy with the Portable Connect in your patient's rehab plan, right?
I do. Yes, we do.
And I mean, what's the best balance that you think you found between the two?
But depending on the situation here in our practices, and depending on the support at home, a lot of these patients, they all start out with the Portable Connect, but we sometimes we incorporate home health from the beginning, just for the first week or two to get the patient, make sure they're safe. I mean, at home,
Right.
and then quickly we'll get them to an outpatient setting. And we usually substitute this, have about 2 visits a week with outpatients. So obviously, a big part of their rehab is from the Portable Connect. Like I said, we encourage them to use this several days and get on it. And so that's a big part. And we're seeing a difference. You know, I think that's what we're seeing in the last 18 months is the transition to the Portable Connect and how much better our patients have functioned. And it's really been a success for us and the patients.
I mean, are your physical therapists a lot happier with patients coming in?
They
and
do. I mean, it's amazing to me that, you know, our home health physical therapists have called back and says, what are you doing different? I mean, the results seem to be so much better. You know, this is obviously making, you know, tell me about this. And because, you know, they don't always get to see the Portable Connect, you know, the ones that the therapists, when by the time they get to the therapist and see the therapist, you know, they say, what are you doing different? Things, you know, and then when they realize what we're doing with the Portable Connect, they say, I believe in this.
Good. We love to hear it. We love to hear it.
Yes.
So, I mean, talking about technology, you know, there's been tremendous innovations over the past several years, and one of those major ones is in robotics. So is robotics something that you use in your process?
Yes. We've been using, I hope it's okay to say this, but we use the Stryker Mako robotics, and we've been using it about 4 years now. And it's just been tremendous success for us. I mean, you know, I don't know of any robotic surgery that's failed. I think not necessarily on my standpoint, but I mean just in general robotics. I was a little skeptical at first. You know, I heard about it years ago, and I didn't really buy into it. But since I bought into it, I firmly believe in it. I just see the difference. It's so much more reproducible, and the patients seem to buy into it. So it's been a good marriage for us. Yes.
Good. I mean, it's always hard, I would imagine, to be like a first adopter of something when you're not so sure on it yet, and you want to see how it goes first.
Well, it is, but it's like, you know, we all like to see gratification, immediate gratification. I think everyone does, and when you can do a surgery and you can look at the numbers, not only you see and feel, but when you have numbers there to back it up and show, you know, here's the results of this and how it matches up, it kind of gives you that good feeling and makes a good night's rest, I'd say.
Yeah, makes sense. So you work in both the hospital and surgery center environments. So now, what do you see as the future for an eventual like all surgery center resource for orthopedic surgeries? Is that a thing?
Well, I mean, of course, I may date myself now, but I mean, when I started off as an orthopedic resident, you know, I tell patients, you know, we used to keep our total knees in the hospital for 14 days.
Wow.
They came in the night before surgery. We worked up, did the H&P, had the surgery next day, and they stayed in the hospital 14 days. And they had their sutures removed and they went home. So it's gone from that now to going home the day of surgery. So we've seen that much more. You know, I think over the years, you know, of course, we've seen this gradual transition. And I think too that COVID taught us a lot, and from the fact that, you know, we can continue to treat patients and get them in the hospital and out of the hospital. So we've learned a lot, and I think that's the way it's going to be continued from here on out.
Okay. I mean, efficiency is the name of the game, right? And with efficiency comes just things moving along a lot faster and convenient.
And obviously, you know, the patients, you know, patients don't want to stay in the hospital any longer than they have to. And so I think knowing that they can get out quicker, I think that's a lot of relief to patients. You know, they want to be in a home environment and, you know, and be able to recover at home. And so I think it's a good thing that things are trending this way. And I think they'll continue to trend this way.
Yeah, I do too. I mean, the Jell-O is good in the hospital and all, but you can get that at home in the comfort of your own bed.
Right. Yes.
So you're pretty active yourself, and a little birdie told me you go to the gym every day at 5:30 in the morning. Is that right?
I do. I've been doing this now for probably about 15 years, and so I enjoy it. I feel like it's, you know, I like to get up, start my day early, and I feel like already by the time most people are rolling over and getting out of bed, I've already accomplished something that morning. So it sets the tone. You know, it doesn't hurt to stay in a good physical shape, and I try to work on that. But it's just good to feel like I've already accomplished something that morning before I get to the hospital. And
that's a great way to look at it. That's pretty good advice for, you know, lazy people like me who aren't getting up to go to the gym at 5:30 in the morning. But for those who are, those who want to maybe get a little bit more active every day, what advice could you give to protect knees and prevent injury while you're staying active?
But I think, you know, first of all, you know, if you've had problems with your knees before, then you probably need to see someone to get some advice and things. But I mean, as you know, there are certain injuries. People may have had certain injuries that predispose them to further problems, arthritic changes down the road, and whether it's their back, hip, knees, whatever. And so there's certain guidelines I think we can give them, and certain exercises that they might want to participate in, other exercises they may want to avoid, and things to try to prevent problems. And you know, some of it's just a little bit of common sense, but you know, it certainly doesn't hurt to have a professional or a trainer, someone that, you know, to give you some advice, because there's certainly if you have some predisposed to certain problems, things can be an issue for you.
Sure. So if you're like me, listeners and viewers, and you have no idea what you're doing in the gym, maybe hire a professional to tell you how to do things correctly for the first time.
I think that's probably a good way to do. Yes.
I think so too. So I thank you so much for hanging out with us. We appreciate your time. And I've just got one more question for you, Dr. Douthit.
Okay.
So what is your hope for the future of orthopedic and patient care?
But I hope that, everything has gotten so impersonal. I think, as far as conversations and things, I still think it's a big part of the interaction between the patients. I don't want to see that. I don't want to see us lose that. I mean, I think it's just real important that the physicians are able to have a good rapport with their patients. I do hope that we find ways to continue to keep medicine available to everyone, to be able to keep things affordable, not only especially to the patients. I don't want to see it get to the point that that medicine gets rationed because patients can't afford it and all. But I think we've got a good trend. I feel like if we can keep on going the way we're going and keep that relationship with the patient, I think we're being good. I'm excited. I'm excited what the future may hold. Like I said, I've been practicing now 30 years. I've seen a lot of changes over the years, and a lot of these are good changes. And so I'm excited at what's going to happen in the future.
Yeah, absolutely. Us too.
Yes.
Well, thank you so much, Dr. Douthit, for hanging out with us. We really appreciate all that you do and all of the great information that you've shared with us today.
Well, thank you. And I want to say, like I said, had a wonderful experience with the Portable Connect and Romtech. You've been a great company to work with, and I'm excited for the future of this company.
Well, thanks so much. We appreciate it.
All
Folks,
right.
Please check out Dr. Douthit at www.northeastorthopedics.com, and all of his contact information and where to find him is going to be in our description box. And don't forget to follow us on our website, Facebook, Instagram, and to subscribe to our YouTube channel. And all of that info is below as well. Thanks again, Dr. Douthit. And until next time, everybody, stay well and keep moving.
Yes.
Bye.
Thank you.
Of course.
Yes.